Medication Administration Training Program. Giving medication to children.
In this section, we'll discuss techniques you can use when giving medication to children of different ages, including those who are uncooperative. The Guidelines for Giving Medication to Children and Special Situations handouts summarize these techniques. When giving medication to children of any age, always act confident and let the child know you expect her to cooperate. Never tell a child that medicine is candy, and be flexible because what works for one child may not work for another. Ask the parents how they get the child to take the medication at home and try to follow the same routine when possible.
Infants.
When giving medication to infants, make them as comfortable as possible. Hold and soothe the infant before and after giving medication. Talk to the child in a calm voice. Give medication before a feeding unless the healthcare provider's instructions specifically state not to. When using an oral medication syringe, give the baby time to rest between pulses of medication. Sometimes young babies will suck medication through a nipple, and that's an acceptable way to give it. But never add medicine to formula or breast milk. You won't be able to assure that the infant has received the complete dose. In fact, the baby may refuse the feeding because of the different tastes. If a baby spits out part of the dose or vomits the medication, do not give the dose again. Call the child's parent and encourage the parent to follow up with the healthcare provider. Write on the child's log of medication what happened with this dose. It's important not to force a crying child to swallow any medication. Infants can choke on liquid medication if not given properly.
Toddlers and preschoolers.
Here are some techniques that work well with this age group. Give the toddler some control, such as letting him pick which stuffed animal he can bring along. Gently explain that what you're doing will help him feel better, and, using a stuffed animal or doll, show the toddler how you will give the medicine. Soothe the child before and after giving the medicine. For a preschooler, explain that you are giving him the medication to help him feel better. Let him know what he can do to help, as appropriate for his age, and thank the child for cooperating. Never ask a child of this age if he wants to take the medicine. The answer is almost sure to be no. Then it will become a battle of wills, and future medication doses will be that much more difficult to give.
School-age children.
When giving medication to a school-age child, give her as much choice as possible. After you prepare the dose, let her take the medicine if she is capable, monitoring closely to be sure the dose was taken, and thank the child for cooperating. But what happens when your best efforts fail and the child refuses to take the medication or you can't give it safely? Never yell at, threaten, or restrain a child in any way, and never force a crying child to take medication. If a child won't cooperate, call the child's parent and let her know that you cannot give the medication safely. You'll need to record this as a missed dose in the section on the back of the Log of Medication Administration.